Welcome back, everybody, to Better Day Podcast. My name is Katrina, and I'm here with Leslie.
Hello, everyone.
Anthony's back in the background, of course.
Hey, how y'all doing?
And we have a special guest today. We are going to be continuing the conversation of continuing care and case management. We're specifically going to be talking about healthcare. So I want you to say hi, Horatio.
Hello, everyone. Pleasure to be here.
Thank you for joining us today.
Thank you for having me.
Can you tell us a little bit about your background and how you know A Better Day and what you do?
Oh, wow. Okay, so I met Leslie, our founder, CEO, leader extraordinaire, through a mutual friend, and me and her hit it off ever since then. She's an amazing person, and I feel like a lot of our goals, a lot of our ambitions, a lot of our values are aligned. We both, at the core of our hearts, want to make the world a better place. And I couldn't think of a more appropriate name for the foundation than the For a Better Day Foundation. So as far as my background is concerned, IT, I love technology, I love computers, I love networking, infrastructure, and everything to do with ones and zeros. And I also got into healthcare because I wanted to do something positive and good. I wanted to do something to help seniors, especially my mom, and seeing her struggle with different health insurance or a lack thereof, and not knowing how to navigate Medicare. And it can become really, really confusing and extensive. So my mom was one of my main motivation to simplify it and be the one to take care of her health insurance. So yeah.
What a great motivation.
I think so.
It
works
motivation. For me. Some of the biggest challenges for people to get that continued care is the big roadblocks of navigating the healthcare system. Can you tell us a little bit about the difference between, most of us don't know the difference between Medicare, Medicaid, HMO, PPO?
AEIOUY,
exactly.
element of P. Trust me, I know there's so many different abbreviations. But so one of the major confusion among people is the difference between Medicaid and Medicare. And when you sit at home, and seniors especially sit at home and watch TV during the morning hours or late morning hours, there's so many different commercials that bombard them. Call us now if you have Medicaid and Medicare, and they talk about benefits, and you have no idea what they're talking about. But I can try to demystify some of it. Especially if you have any questions, please feel free to chime in. So one of the major differences, one of the major challenges with health insurance is even knowing something as simple as Medicare and Medicaid, and make it more difficult, they sound similar. But in a nutshell, Medicaid is from the state in which you reside, and Medicare is a federal health insurance program. So Medicare you become eligible for when you're 65, providing that you've earned enough work credits over your lifetime, which is pretty easy. It accounts to basically just 4 years of work and paying taxes to get your 40 points to qualify for Medicare when you become 65, or if you become disabled or suffer from some significant illnesses that would qualify you for Medicare at an early age. We won't get into Part A and Part B and Part C and Part D and all of the different things tonight. But even Medicare itself has its own jargon that, can be challenging to navigate. Now with Medicaid is from the state to help low-income seniors, and not just seniors, actually, pregnant women or even disabled or anybody who is struggling with a really, really difficult time. If your income is low, the state is there. The state provides you with health insurance. And that's the major difference if I'm keeping it super simple. I hope that was simple enough.
It was. So to make it clear, Medicare, people that qualifies for Medicare are two kinds of people. People that are 65 and older.
Correct.
And people that are disabled.
Correct. Or suffering some extreme illnesses.
And Medicaid is based on financials.
Correct.
Underserved populations that they don't make enough.
Correct.
Can qualify for Medicaid.
And Medicaid is state and Medicare is federal?
100%.
Okay.
Cool.
So how people can apply to Medicaid?
That process in of itself can pose some significant challenges because even the questions that they ask sometimes is not that easy to understand. and it is a process. So they can go to My Access Florida. You can just Google My Access Florida. So it'll be the first thing that pops up. You click on it, and if you already have an account, you log in. If not, then you click on register. It'll ask you, some personal questions. You fill it out, and then you can actually apply right then and there for Medicaid benefits on the website. It can be a little challenging, but with a little bit of patience or reaching out to somebody knowledgeable if you have any questions, it's definitely doable.
It's super important that they have the right guidance, because with insurance, we come across a lot of clients. They have been misinformed, and oftentimes they have the wrong plan.
Well,
they can not see. So how can people get in touch with you, Horatio? Because I know that you guide them through, the whole process to get Medicare, Medicaid, and those are the basic ones, but there's other opportunities for other people to apply, which is ACA and all that. But how can they get in touch with you?
Well, they can reach out to me at my phone number or my email address, 954-681-5307. Just ask for Horatio. You're not going to get any IVR or press 1 for this or press 2 for this. I'm a normal person. I'm an advocate. Any kind of health insurance question that you may have, I'm happy to make myself available to help in any way that I can. You asked another question. Could you go back to that a little bit?
ACA.
Oh, ACA. Okay, so we already covered Medicare, we covered Medicaid, so now let's cover ACA, the Affordable Care Act, affectionately also known as Obamacare. When you drive around everywhere, you hardly see ACA. You see Obamacare everywhere with that little O logo. But what that is health insurance for private individuals and private families has been so important and so expensive, because what happens is, if let's say you're an independent contractor or you work for somewhere that does not provide work group coverage, you have to foot the bill for insurance yourself, and it's so expensive that it was literally unattainable. And that also puts a strain on the state's Medicaid system, because people need Medicaid. Not only that, but our health insurance. But if you don't have health insurance and you have an emergency, where do you go? You go to the emergency room. A lot of times, because people don't even have insurance, they go to the emergency room for things that are truly not even emergencies. So as I won't go into the history of ACA or how it came to be, but ACA basically has made private insurance for individuals within the range of affordability that matches or at least competes with what you can get from your workplace most of the time.
And there are different companies that follow under Obamacare. That could be Aetna, Cigna.
Yeah. So these
Oscar.
are what you call carriers or providers that tie into the ACA system, and that can be really tricky and really complex and time consuming to navigate, because different carriers have different plans and different plans have different features. And I use the word features very specifically and intentionally, because a plan may have several features, but they're not necessarily benefits, because they're only a benefit when those features is a direct benefit to you. For instance, if one plan comes with 80% off 10 eyeglasses for the year, but you don't have any optical vision issues, then that's not really a benefit to you. It's a plan feature, but it's no benefit to you. So I'd always advise people that whenever you're going through ACA, if you're doing it yourself, it's going to take a lot of time, but be very careful. Go through everything line by line. Make sure that the features that the plan offers is truly a benefit to you. The other thing I would say is that you really should be working with a professional when it comes to ACA, someone who's going to listen to you, someone who is going to address your questions, your concerns, and is going to guide you in the right direction, because, they're the expert. So you really should be using or working with someone who's an expert in this field, because it can get tricky.
With Katrina, we come across a lot of clients that sometimes they have spoken with an agent or somebody over the phone, and they get enrolled into a plan that unfortunately, they cannot get the help that they need. So I totally agree with you that they need to get the right guidance, so people to do a comparison, shopping around between this provider, this other provider, this other provider, and see what fits that person's specific needs. Unfortunately, as we mentioned in a couple of other podcasts, there's a lot of fraud. There
It's a
is a
sad
lot
reality.
of fraud. I mean, even Katrina, she can share her experience with.
Yeah, I've come across, patients and clients who have one insurance and, we go to run it or something and they have three others. I mean, myself alone, I started out with Cigna. I paid for Cigna. And then all of a sudden I had Aetna, or I had a different Cigna plan. And then I had something else. I never applied for any of those.
It's a sad reality, and it happens all too often for sure. But what I would advise is to report all of it. Report all of it. Report it to ACA. Report it to CMS. Report it to even your local authority, the local police station. Report it, because, and even then, it still might not be enough, but at least we're doing what we can. But it is a sad reality because there is money involved in this and there is commission involved in it. So again, whenever you're sitting with a professional, make sure you feel comfortable with this person. Make sure that you are convinced that this person is invested in your health and your well-being and looking forward to a long-term relationship with you, holding your hand every step of the way. It's super important. Anything that involves money, and then people are always have incentive or motives, and they might not always be aligned with your best interests. So again, please feel free to give me a call. I treat everyone like my own mom.
One of the other big issues with what is going on and when sometimes people are put in the wrong plan is the fact that at the end of the year, this becomes a tax deduction or can be a double-edged sword and become a liability, and people could end up paying more money to taxes, right?
Even worse still, before we even get to that tax point, a lot of them are on plans that they didn't know would not cover their needs until they had a need that could not be covered. And then, like you say, yes, with a tax liability. So it's actually an excellent point that you brought up. So you should definitely be having a conversation with your tax preparer, your accountant, to find out what are the potential implications of whatever plan that you choose. It's a real serious conversation. I'm glad we're having it because a lot of people are not even aware of this. So good point. Good catch, Leslie.
Anytime. I mean, this is what we do every day because we do case management with Katrina, and we come across a lot of patients and clients, they have been put or somebody helped them or somehow they got insurance, and unfortunately that insurance doesn't cover their needs. Imagine going to the hospital and getting a bill for $10,000 and you have insurance, but the insurance doesn't even cover that. And you don't even know what went wrong. And it's because they were put on the wrong plan.
Not exactly insurance at that point, huh?
Yeah. Right. And speaking of put on the wrong plan, I have someone who's currently, called so they could get care through one of our offices and case management and behavioral health. And she has Humana Medicaid. And
so that'd be Humana Healthy Horizons?
Well, she called to get the benefits and tried to change to something that would benefit her more, and they declined.
Well, you can't just up and change your insurance plan whenever you want, which, again, stressing the importance of making sure you sit with a qualified professional that has your best interests at heart, is going to guide you carefully, because you can't just change insurance whenever you want.
I think one of the points that we need to make here is that a lot of people in the audience don't know that once they apply for Medicaid, they can actually request a carrier, a provider.
Yes, absolutely.
And people don't know that. And
absolutely.
They think because they apply to Medicare, they're getting this freebie health insurance, they are a will of, Medicaid. And that's not accurate.
True. So you can actually go on the website, Medicaid, and you can see the different carriers and the different plans and to see what they cover to make sure that the one that you're on is aligned with your needs. And then you can just call them and say, hey, I want to switch from, if it's Medicaid, you can call Medicaid at any time and say, hey, I want to switch my carrier from Humana to Aetna. or vice versa, or whatever. Not that, and I want to make it clear, disclaimer, that we are not promoting or recommending any carrier over any other one. We're just using these as random examples. But yes, you can. If it's Medicaid, you can call them and say, hey, I want to switch to this, and they'll send you your new cards and everything in the mail. And it's simple.
I really want to point out this is a specific case that Katrina is speaking about because it's a mental health related.
Right.
And then when it comes to mental health, that patient have to feel comfortable. They don't want to go just to any doctor. And a lot of our clients or people that are suffering from mental health challenges do not feel comfortable going to just anybody. They have to build rapport. It has to be trust. And what if that provider that is not part of Humana or whatever that person was assigned by Medicaid and call Medicaid office and say, well, tough luck.
Right. What do you do in that case? What do you do?
You're going to fix this later, right? Too bad. Repeat that, please. The last part. I didn't hear the last part.
It's tough luck. What do you do when somebody, calls Medicaid and say, I have a provider. I feel comfortable with that provider and I cannot open up myself to any providers. Can I change my plan?
And then what do I change it
And
to?
the person say no. The Medicaid people say no.
So,
Right.
well, Medicaid people can't say no.
Well, they did.
What they did.
I would strongly recommend you call back in and get somebody different because
Or get a email.
because you
Can they send emails?
No, just do it over the phone. But not only that too, but so if they have a provider, and by a provider you mean a doctor, correct? Okay. So if there's a provider that they preferred, as long as there is a plan from one of the carriers that supports the Medicaid program, or enrolled in Medicaid program, provide Medicaid services, as long as one of those plans has their provider in network, they can get that plan. The Medicaid can't tell them no.
So they gave her a list, but they didn't give her Better Health, right?
Right.
Aetna Better Health. And that's weird because Aetna Better Health is Medicaid.
It 100% is
And
Medicaid.
but they didn't give them that plan.
Yeah.
Sometimes a carrier is still working out contract and agreement with the program, so maybe it just wasn't good to go at that particular
But
time.
you know what, Katrina? United. We take United.
Right.
Did they offer them United?
I don't recall. I can talk to her tomorrow.
Yeah, but Medicaid
Because
people,
this
they
is
can't say no.
great information.
And if the next time someone says no, ask them why. Get their name and any other identifying information, and ask to speak to a supervisor, or even report it to like your local congresswoman, your Florida congresswoman, or something like that. Find out who is in your district, who's the congresswoman over your particular district, and send a letter and email to their office, because this is a public program. It's not private. Right. It's for the people.
Right. So Medicaid was state, correct?
Correct.
Okay. So each state, do they differ when it comes to what provider or what insurance is?
Yeah.
Okay.
Different states offer different programs, different features, different benefits, or different ways of how they do things, different criteria, because obviously it's up to each state, the sovereignty of the state. But for the most part, they're pretty similar for the most part.
Okay.
Yeah. I forgot what California calls their Medicaid program, but California is different. They call it, instead of Medicaid, they call it something completely different.
Oh, really?
Yeah, I think they call it like Medi-Cal or something like that, or Cal, or I forgot what they call it. But
California always has to be a little different.
they're their own country.
I think the most important thing here is to let the audience know that they are empowered to choose what is right for them.
Yes.
What fits their specific needs.
Yes.
And make an educated decision. Like Horatio said, look for somebody. You can reach out to us. We'll give you guidance. We can connect you with some people that, are always helping our clients, that can actually walk you through the whole process and give you the alternatives that perhaps may fit your specific needs.
And not only that too, but what I would advise everyone who is in need of any kind of health insurance is, you have to be your number one advocate. Like, you have to be the one to make sure that you're pushing, make sure that you're asking the question, make sure, because you know your situation better than anybody else. And unfortunately, there are incentives. And sometimes, there's bonuses with this program versus that for this month. And, your representative or your healthcare or your health insurance professional, might have an incentive to put you on one plan over the other. So while there are a lot of really, really good insurance agents out there, you still have to make sure that you're being, or at least do your best to make sure you're being your number one advocate and standing up for what you know you need and what you know you want. So, yeah.
I have a question. What happens if you lose coverage? What steps should someone take?
Oh, it depends on what kind of coverage they had. It depends on when they lost it and what coverage they need, really. You'd have to ask that question more specifically.
So example. So if somebody was on Medicaid and they lost it and they don't know why they lost it, what would be their steps?
The number one reason why people lose Medicaid and don't know why they lost it is because they didn't pay much attention to that letter that they sent them in the mail saying you have to renew. Because for the most part, if you have Medicaid, like, you're good to go. Like, the criteria doesn't really change that much. The only thing that people really lose Medicaid for is if for some reason they did an investigation and found out that, wait, you're actually a millionaire, like, not necessarily a millionaire, but making a lot more money than what you originally reported, then you could certainly lose benefits. But outside of that, you only ever lose benefits if you just don't renew it.
Do you know what that time frame is? Just
3 months normally. 3 months.
Okay.
And another thing too, so if you have Medicaid and Medicare, and if you lose your Medicaid, because normally when you have Medicaid covers the cost of your Part B, that monthly obligation for Medicare. Medicaid will cover that. Because if you have Medicare and Medicaid, the state says, hey, we'll pay for their Medicare. Medicare will pick up the bulk of their health needs. So it's more cost effective for the state to pay for their Medicare Part B obligation on a monthly basis. But when people don't renew their Medicaid for whatever reason, like Leslie mentioned, some people have mental health challenges.
Right.
And they just can't see themselves navigating that. Sometimes they really don't want to bother people, and they just kind of let it lapse. They forget in the back of their mind, out of sight, out of mind. And then 3 months later, when they're expecting their Social Security benefits to hit in the account, their Social Security benefits is a huge chunk of it is missing. Like 3 months, the 185 times 3 months comes out of their benefits immediately. And that's when people start panicking and reaching out, like, I don't know what happened. And then we have to fill out the paperwork for them or with them and try to get their benefits restored, get their Medicaid restored, and get them refunded back that the Part B.
And this is why, For the Better Day is doing what we do, because it's very challenging for even a person that is 100% healthy and 100% there to navigate this healthcare system. They get
So
the
true.
information. They don't know who to call. Oh, what is this? What is that? As it is very complex. The fact that it's Medicare, and if you don't have Medicaid, who covers your premiums for Medicare?
You or your Social
You
Security.
or your Social Security. And then you have to make sure that you renew that Medicaid.
Absolutely.
So you can get 100% coverage, and you can get
Continued
the premiums cover and continue care. But it's very complex for a normal person. Imagine somebody
Absolutely.
that is going through challenges.
Absolutely.
The other thing that is my goal here with the nonprofit is that, yes, we do have a lot of homeless. We have a lot of people that sometimes move around a lot because of financials. So they don't have a steady address.
Right.
It is a challenge.
It is a challenge
It is
because
definitely a challenge.
what happens when they don't get that letter in the
They
mail?
don't renew it. And
They
then,
don't renew
and
it.
then they're
They
in a
lose
worse
it.
situation.
Exactly. They cannot get their ongoing care. Some people, especially with mental health needs, they depend on medications
100.
to be able to avoid their episodes and all that. So if we can have a space to hold their mail and be able to manage and help people like that, that's like one of the things that I would love to do. because I see firsthand that people are trying to get better. And,
Absolutely.
And they're so, I mean, they have to struggle with so many things, and they have to try to navigate and jump these roadblocks.
Absolutely. And if they're making any kind of effort whatsoever to be better, we shouldn't make it difficult for them. Anybody who's trying to get better, trying to be better, trying to do better, we really should not make it difficult for them. And as you know, I do a lot of people's Medicaid for absolutely free. Free, not necessarily because I want to, but because even though it is health insurance as provided by the state offers absolutely no commission whatsoever, unlike other health insurance programs. The state offers no compensation to a licensed professional such as myself to provide these critically, desperately needed services that actually do benefit the general populace. Don't understand the decision on that one. I've heard they mentioned the potential for fraud and abuse. Well, fraud and abuse is in every aspect of insurance, so, but regardless, we still provide the service, we provide our time. And in the hopes that, they get better. They get the care that they need and they get better. So, yeah we still do it.
Yeah, we do. Yeah. We do, Katrina.
I know. Horatio, what do you think some of the biggest misconceptions are around Medicare and Medicaid? I know.
That's a tough question. And I got to tell you, I honestly don't know because,
really?
I'm on the professional side of it. So it's my job to know, to understand. But one of the biggest misconceptions, I have no idea, really. I have no idea. I know there's a lot of confusion, but misconceptions, not too much. There's a lot of confusion.
Yeah.
But misconceptions, I wouldn't know. But that's a good question.
I think one of the biggest one is that everybody thinks that Medicare is only for 65 and over.
Yes.
That is true.
That is
true. Okay, that is a big misconception. Yes.
That's a good one, Liz.
And there's two people that qualify for that, 65 and over, and also
anybody at any age with some significant health challenges or illnesses. In that vein, another big misconception could be that as soon as you turn 65, you automatically qualify.
Oh yeah,
and that's not the case either. Got to get your work credits in.
And also, if you are 65 and over and you do qualify, there are penalties.
Oh yeah, late now. So
really,
there's definitely some penalties if you enroll late. Well, so if you enroll late for Part B, so let's just say that you're turning 65 in, let's just say 2025. And then, but you say, you know what, I'm going to keep my workplace insurance that I have now until I retire. And I'm not going to retire for the next 2 years. So come 2027 now, you retire from your job, you no longer get the workplace coverage, and then you go, okay, I'm going to enroll in Part B now. Well, there is a 10% penalty from the Part B for every year that you were eligible to enroll when you first became eligible until when you actually do. So that's going to be 10% and 10% added on to the your Part B. So doing some quick math here, I would say that would be about, instead of 185, now you're paying close to 200. No, you're paying over 200. You're paying about $205, $207 now for your Part B. And if this continued for more years, then obviously, 10% for every year that you didn't enroll.
Wow, not a lot of people can afford that.
Well, the good news is for the people who genuinely have financial limitations and can't afford it, hopefully they would qualify for Medicaid, and Medicaid would still cover that for them.
So there's hope.
So there is hope. Okay. But, unless, and I feel like only two kind of people really fit into this category. Either the people who had a really good job, who can afford it, or the people who they didn't really want to keep working, but they needed the money. So, then hopefully when that job is no longer there, the good people at the state of Florida and Tallahassee will come through for them, the taxpayers.
So keep in mind, 65, no matter if you qualify or don't qualify, just double check with an expert.
Yes.
Yeah. An expert.
And don't wait till you're 65. Don't wait till you're 65. Ask those questions when you're 55, because at 55, 56, 57, 58, you still have time to get those work credits in, so that by the time you do reach 65, you're good to go. Additionally,
be very cautious, because you might be getting a lot of phone calls from
Yes.
agents, from people that they're after your data. And, you know, sometimes they can utilize addresses. There's a lot of checks that they get lost in the mail. If you get checks that happen to, you know, people that I know.
It does happen.
So
And another thing too
be
is,
careful.
again, remember that that there is a financial incentive here when it comes to Medicare. So you definitely will always have people blowing up your phone, calling you from everywhere, and they'll sound very convincing. They'll sound very legitimate. Be very careful. Like, if you didn't, you know, why are they calling you? So just be very careful. Speak to trusted advisors. Speak to other people you know who are already under Medicare. Ask them, hey, you know, who did your Medicare? You know, get a referral. Do people you trust. Use people you trust for referrals, and not only that too, but yeah, actually that's it.
So for those type of phone calls, how do you recommend that
Hang
the
up.
normal person
Hang up.
Okay,
Hang up.
just hang up.
Hang up. Hang up immediately. Block the number if you can. If you know how, block the number. Yeah.
And you know, it's great that we have you as support and an advocate. But what if someone can't get a hold of you? You know, where would they turn to?
Hopefully they know somebody who is 65 and older, you know, and again can ask for a recommendation.
They can
Yeah.
always email to us or call us too.
Yeah.
And we'll refer them to, you know, we guide them to the process. That's part of case management too.
Yeah.
So they can always reach out to us at info@betterday.foundation.org or give us a call, and then we'll connect you with Horatio. If you need Medicare, or on any other insurance, we'll find somebody that can help you.
Absolutely.
Yeah, and you know, speaking of case management, Horatio, we deal a lot with substance use disorder. You know, have you experienced that with Medicaid, Medicare? Where does that fall into place when it comes to people needing specifically insurance for treatment?
I believe that one is called dual diagnosis. That's what I was looking for. Dual diagnosis. Anybody with dual diagnosis, if a medical professional says the patient presents with both a substance use disorder and mental illnesses, then they automatically qualify for help. So yeah,
Did you hear that? Repeat that.
you automatically qualify for help as long as you are diagnosed by a mental health professional to present with both substance use disorder or a history of substance use disorder and mental illnesses. You don't have to currently be using. You just have to have an established history of both of those. And yeah, you qualify for dual diagnosis and you automatically get Medicaid from the state.
That's very empowering to hear, I'm sure, to a lot of people who weren't aware of that.
Absolutely.
Yeah. Open enrollment. I want to talk about that for just a moment because a lot of people, and myself included, get confused. Is there only a specific time that you can apply for insurance? Is it because
Yes
I know
and no.
Medicare, Medicaid, and ACA, it's all different.
It's all different. So that's why the answer is yes and no. So when it comes to Medicare, Medicare does have an open enrollment period, and that is from October 15th all the way to December 7th. And then there is a pause on that. And then after open enrollment comes the annual enrollment period, which is from January to March. So there's a pretty wide window there. And there's different rules that apply to when it comes to open enrollment and annual enrollment. Open enrollment is when, agents like myself get to go all out. We can advertise, we can hold seminars, we can, jump under the new plan for 2025, 2026, whatever the year is coming in. And there's always changes in Medicare. So it's a good time for us to reach out to our clients and our potential clients and explain the differences that's coming up to them. And if they like us, give us the opportunity to put them on a plan that they feel is going to be better for them, or even keep the plan that they're currently on if it's going to be better for them. And then after open enrollment is done, then it's annual enrollment. And during annual enrollment, if you didn't like the plan that you signed up for in open enrollment,
Right.
If now that the cooling off phase is in, and you're like, wait, I don't think I really like this plan anymore. Or you're talking to your neighbor and your neighbor is saying, oh, you should see this plan that I've got. It has this, it has that. And you're like, wait, my plan doesn't have any of that. You know, it gives you the opportunity to change whatever plan that you signed up for during the annual enrollment period. And that's where open enrollment period comes in. So it's AEP first and then open enrollment period. And it's similar with ACA. ACA also has an open enrollment period as well, and towards the end of the year. And your coverage starts as soon as you make that first payment to your ACA. Now, when it comes to Medicaid is all year through. It just, depends on your financial situation at the time. To make whenever you become eligible, whenever you face that financial difficulty or loss of income or something like that, then as long as you can show that your earnings have significantly decreased to where you fit in the criteria, then you become eligible. And also with going back to Medicare for a bit, you can become eligible throughout different points in the year, depending on your situation as well. So like if you move from Miami to Palm Beach County, as long as you move from one county to the next, then you become eligible again. And that's called a special enrollment period, because now you have to get all new doctors and everything else, and you have to go with a plan that covers the area that you're in now. If there's a disaster that happens, a hurricane or something like that, then you also qualify for a special SCP as long as it's been approved by CMS, Center for Medicaid and Medicare Services. You also become eligible throughout the year for Medicare if, you age into 65. That's called your initial enrollment period. And there's also other special enrollment periods. So, for instance, if you're on a plan that you're like, I thought this plan was going to be good, but every time you try to make a claim or use your benefits or something like that, you get denied, and you're like, this plan is not as good as I thought it was. You can, any point in the year, you can change your plan even without a special enrollment period, as long as you're going to a Medicare program that's a 5-star program. And what a 5-star program is let's just say XYZ health insurance company, who's a provider for Medicare, the year before they did so well that they got the highest ratings. So the highest ratings is a 5-star. So because this plan is now 5-star because of how well they operated the year before, Center for Medicare and Medicare Services says, hey, good job. Here goes 5-star. You get special privileges. Anybody can jump on your plan anytime throughout the year if they want.
Oh, wow.
One time for the year. That's your reward for being so highly rated to Medicare recipients.
Oh, wow.
So there's different ways. There's different ways.
Let's touch base on that. You said a good word, appeal, or I'm saying a good word, appeal. When they're denied, can you appeal, and how do you go about doing that? And
absolutely. So you can send a letter. You can send a writing. So when you get that denial letter, you can take that denial letter and then you can file an appeal. You can say, hey, insurance so and so, according to my plan, this is covered. I believe I've met all the criteria. I believe this is a legitimate claim. You can ask for a reconsideration.
Okay.
So, and most of the time they will grant a reconsideration unless they have like strong reason why it should be denied. Like, you had previous work done there, and they're like, okay, well, why is this being done over again? Sometimes it warrants an investigation. Sometimes the doctor or the provider has to provide enough reason, or have to justify why this was done. And they can provide the evidence and say, okay, this was done before, but X, look at this, and this is how we determined that this was medically necessary to be done. Then you have a much stronger chance of that appeal being successful.
So even if you're denied, it's not the end.
It's not the end. Yeah, denial is not the end. Could be, but you won't know unless you appeal.
Right. Has there been any recent policy changes that the general people should be made aware of?
That there is a lot more mental health services covered under Medicare for 2025.
Oh, that's great.
Yes, like a lot more. The floodgate has been opened. So yes, that's one of the major things I would say. For sure.
Which we need. Which
is very important.
Very important. I mean, that's the whole point that we do here at A Better Day.
Absolutely. So yeah. Any other questions or no?
Well, what's one piece of advice that you'd give someone that's struggling, that's just completely struggling to navigate, that can't
just
Reach
Has
out.
nowhere to go.
Reach out. Reach out.
There you
Ask
go.
for help. Reach out. So we're happy to help.
Yeah.
We're happy to help. Yeah.
Well, everyone, thank you for joining. Leslie, do you have any last minute?
No, I just want to thank you, Horatio, for all you do, for your support, your knowledge, and for helping the community always.
Hey, thank you. And it's a mutual feeling. Like, thank you guys for everything that you do at the Better Day Foundation, for a Better Day Foundation, and all the hard work that you guys are putting into the community to help, make this world a better place and help a lot of people have a better day. Thank you guys so much for having me. It's been an honor and a privilege and a pleasure. I enjoyed this a lot. Thank you so much.
I appreciate it. Thank you for breaking this down for us, Horatio.
My pleasure.
Everyone, until next time, have a good night.